I started this topic about 13 years ago when I was asked to speak at an Oregon Pharmacy Association about drug-herb interactions. It's kind of one of those invitations that you know you have to do. Here's American Botanical Council has a great herbalgram. They come out every year with kind of the sales data. And you can see this probably rivals anybody in the herbal industry will tell you 2000 was a watershed year. And after that, things are just pretty much up. All right, now we're getting into the real meat of the issue. And this is one that can get to be the most complicated. And this is the idea of the P450 human cytochrome isoenzyme systems. We know there's up to 57 CYP proteins. All right, 0.5 is herb can increase or decrease the drug absorption. And so I added this maybe 5 years ago when I started realizing the herb themselves, besides the cytochrome P450 system, has potential to increase or decrease absorption because of the compounds in it. And so it's a typical model would be high fiber plants or high tannins plants or plants with a high laxative effect. Induction of CYPs and can lower some studies. It's mixed. So, and CBD can cause inhibition. Again, the studies are not 100% clear because it's so new. So that's, again, the studies say if one inhibits and one induces, if you use them together, you're likely to get less problems. But grapefruit and St. John's wort would be really caution. Milk thistle, I think, can be very helpful. You just got to watch it. So that's the most for oncology that we've seen. This is a few. So this was St. John's wort and CA4, 3A4, and 10 cancer patients. And they were given a cancer drug, and they were given a standardized commercial 300 milligram tablet of St. John's wort with the standardized amount 3 times a day. What I highlighted in this was the drug levels were decreased by 12 and 14%. I called him back, and he said what he's taking is 20 milligrams of CBD per dropper. And so he's taking 60 milligrams of CBD a day. Likely on the label, it's 80% CBD. It also had minor cannabinoid CBG and CBC. It's important when you see those to understand that it's not an isolate, because you can get a yellow purified powder that's all CBD, meaning you're going to have to ask your patients what they're taking. And as a naturopath, I always use that model: bring everything in and we'll look at it, because it does take a minute to understand what's in there, but understand the native, the standardized, and the isolated. And if you understand that, you'll really, the dose and the duration is fairly easy.